Good day. My name is Mrs. Lashman, and today I'll be presenting cystic fibrosis. Our learning outcomes will be what is cystic fibrosis, the pathophysiology, the symptoms, complications, their diagnosis, and the treatment thereof. We will be going about our learning outcomes by making use of gaming environments such as quizzes, as well as virtual reality technology to explore the human body and also make use of a virtual stethoscope to explore uh, different lung sounds. Okay, so as I mentioned in the previous slide, our lesson is not going to be just about the slides, but making use of different media to learn and teach at the same time. So on this slide, we have our quiz, which is going to test your prior knowledge of the respiratory system. So it's a basic labeling quiz that you're going to label the respiratory system. So if you guys can just have a look on your WhatsApp group that we have made for the class, I will send the same link to the group, and you can open up to that link. Once you open up to the quiz link, it should look something like this, where you will answer the different questions it asks you, and you will make use of a multiple choice system to answer the questions correctly. So we will have 5 minutes for this quiz, and then we will continue with the lecture. So what is cystic fibrosis? What do we know about cystic fibrosis? So cystic fibrosis is a disease that affects multiple organs in our body, including the lungs, the pancreas, as well as the liver. It is a progressive condition that changes the consistency in mucus in different organs. It is a genetic disease and is coded in our DNA. Let us now explore the pathophysiology of cystic fibrosis. People with cystic fibrosis have a mutated gene known as CFTR, which prevents the CFTR protein from working properly. CFTR stands for Cystic Fibrosis Transmembrane Regulator. This protein controls the movement of salt and water in and out of cells. It is a gene that transports two ions, namely chloride and sodium. In order to be diagnosed or have the gene of cystic fibrosis, one faulty gene has to be inherited from each parent for there to be a chance of being born with cystic fibrosis. So both parents have to have the cystic fibrosis gene. As indicated in our genetic diagram, we see that both the parents, mom and dad, have the gene of cystic fibrosis, which then makes the kids have a 25% chance of having cystic fibrosis. All parts of the body are affected, but people who have CF commonly have a lot of trouble in the lungs. The lungs are generally well lubricated, but when sodium and chloride concentrations change, they directly affect the mucus in the lungs. It then becomes thicker. When it becomes thicker, it leads to more infections that are rather rare in people without CF. So now we have a recurrent infection rate in a person with CF. It also causes the patient to have difficulty breathing, which then leads to a decrease in concentration of oxygen in the body. Another area that is affected in the body is the digestive tract. The pancreas, that is located under the diaphragm, has the function of secreting digestive enzymes. When affected by CF, these enzymes cannot be secreted effectively, leading to nutrients not being absorbed and then essentially leading to malnutrition. The pancreas is also responsible for secreting insulin, which is a chemical that regulates blood sugar in our bodies. Not having enough insulin will then cause the patient to have symptomatic diabetes. The liver, which is on the opposite side, is responsible for secreting bile. The mucus in the duct stops bile from getting secreted from the liver. Bile helps us to emulsify fats that we eat and also to assist to digest those fats. Now, due to the faulty gene, chloride in the cell is not able to move to the cell surface. As a result, water is not drawn into the cell. And as we know, if our cells are dehydrated, it to other symptomatic complications like a reduced blood volume, electrolyte imbalance, and also kidney problems. The mucus in the different organs become very viscous, which leads to the basic functions of these organs being affected. Let's have a look at our symptoms. We have then salty tasting skin in cystic fibrosis. As a defective, CFTR protein causes salt to build up on the skin surface instead of being reabsorbed. Hence, the increased amount of salt tasting skin that you get. A frequent cough with phlegm. This is because the mucus clogs the airways, leading to persistent coughing, and the coughing is just a reflex of to get that phlegm out. Difficulty in gaining weight. Remember, we mentioned the poor absorption of nutrients due to the thick mucus blocking the pancreatic enzymes from being secreted. You then have your greasy stools, where it is because fat isn't properly digested or absorbed, leading to fatty stools and also foul smelling stools. The term for this is called steatorrhea. You then have wheezing, which is due to your narrow or inflamed airways from mucus buildup causing wheezing. We also have difficulty breathing. The difficulty breathing comes from the mucus that blocks the airflow in the lungs, making breathing harder. Recurrent infections of pneumonia and bronchitis. The recurrent infections are due to the trapped mucus that creates a breeding ground for bacteria in the lungs. Nasal congestion and polyps. The nasal congestion and polyps are due to the chronic inflammation and mucus buildup in nasal passages that lead to polyps and blockage. This will be the virtual stethoscope that we're going to be making use of. We can get to use the virtual stethoscope of our lecture, where we can get to assist each other in groups, where we find the different sounds that is asked in the um, above the screen. So, for example, here in our screen, this is what it will look like. On the right hand side, it asks you to find the crackle. You're going to listen to sound one. You select sound one. You will listen to it. If it's a crackle, you will select submit. If you don't think it is a crackle, you will not submit that one. You will play sound 2, 3, and 4, and you will identify which is the crackle sound. It'll give you different questions like identify the wheezing sound. You will listen to all the sounds and then submit the right answer. The blue logo here, Letman TM Learning, is the logo for the virtual stethoscope. After the lecture, you can get to download it and make use of the virtual stethoscope to learn the different lung sounds from the normal to the abnormal. This brings us to the complications of cystic fibrosis. At number one, we have fertility difficulties. Thick mucus blocks the reproductive ducts like the vas deferens in males and cervical mucus in females. Sinus infections are due to the mucus buildup in the sinuses that lead to bacterial growth and frequent infections. We then have osteoporosis, which is due to poor absorption of vitamin D and calcium, which affects bone strength. Liver issues or liver disease is due to thick bile that block bile ducts, leading to liver damage or cirrhosis. Diabetes. Damage to the pancreas affects insulin production, causing cystic fibrosis related diabetes or symptomatic diabetes. Malnutrition or vitamin deficiencies due to mucus blocking the digestive enzymes from reaching intestines, reducing nutrient absorption. Rectal prolapse may be due to frequent coughing and straining increase in pressure pushing part of the rectum out. So how do we diagnose cystic fibrosis? Cystic fibrosis can be diagnosed in various ways. We can diagnose cystic fibrosis by doing a newborn screening, when newborns undergo a blood test to check for elevated levels of a chemical called immunoreactive thyroxinogen or IRT, which is produced by the pancreas. You then have sweat testing, where if a child or an adult shows symptoms of cystic fibrosis, A sweat test is performed to measure the amount of chloride in their sweat, as people with cystic fibrosis have higher levels of salt in their sweat. We can then do genetic testing, where genetic testing can be done to identify mutations in the CFTR gene, which is responsible for cystic fibrosis, or clinical assessment to assess the patient's symptoms and complications. There is currently no cure for cystic fibrosis, but treatments have greatly improved over the years. Newer medications like CFTR modulators significantly improve the quality of life and life expectancy by targeting the root cause of the disease. We have treatments available such as airway clearance techniques, which help loosen and remove thick mucus from the lungs to improve breathing, medications such as antibiotics to treat infections, bronchodilators to open up the airways, and anti-inflammatory drugs to reduce inflammation. Physical activity, which enhances lung function and helps loosen mucus naturally through movement and deep breathing. Pancreatic enzyme supplements, which aid in digestion and improve nutrient absorption by replacing blocked enzymes. CFTR modulators, which target the defective CFTR protein to improve its function and reduce symptoms at the cellular level. So here comes the fun part. We will be making use of virtual reality after this lesson to explore the lungs, to visualize the pancreas and the affected organs in 3D and see how cystic fibrosis impacts them compared to healthy systems. We have now come to the end of our lecture. Thank you for listening, and I hope you all learned about cystic fibrosis and understand the pathophysiology of cystic fibrosis.